us a little more about how a speech-language pathologist can help overcome some obstacles that children with ASD may face when trying to communicate illness or pain.
Well, one of the most common things that doctors will tell you is that one of the greatest barriers they have to treating the child with ASD is communication. And how do I communicate with this child? How do I ask the questions like, how are you feeling today? What's wrong? Are you sick? And getting an answer that sort of follows that question is very difficult for a child with ASD. So one of the things that speech-language pathologists can do is to work with families from a very early age, helping children understand how to frame the language of pain and illness. And it's not something we want to think about, and it's not something that we want to work on. And yet, if we don't, no one ever will. And so if we have a child that falls down, we can immediately give the context of, oh, I bet that hurt. Or how much does that hurt? Because we have scales of pain. We have things that hurt very little, like a little scrape on the knee, and we have things that hurt quite a lot, like breaking bones and things like that. And the child with ASD may not feel pain in the same way everyone else does because of sensory processing problems. So it's really difficult for us to gauge how much that this does hurt to this individual, because we've seen children and adults with ASD who walk around with broken bones that, like it's nothing. And so we really have to be very careful in how we do that. Part of the thing that we can do is we can use the augmentative communication systems, whether it's high-tech or low-tech, and we can give children visuals as to, scraped knees and headaches and things like that. And we can give them the language that they might need to say, I don't feel well, something is wrong, something hurts. We can work on social narratives and social scripts about, when we go to the doctor, this is what he's going to ask. These are some answers that you can give. If we just stop with, how are you? I'm fine, we've missed a whole lot of things, because we're not always fine. We need to work past just the first, common answer that we give to most people, because when the doctor asks, how are you? What he really wants to know is, how are you feeling? Whether that's emotional pain or physical pain, we need to be talking about these things very early. Video modeling, all the things that we would do for every other aspect of language therapy, we can do with medical language that this child needs in order to access that care. And it just takes targeted practice, a lot of practice from a very early age in order to give them the language that they need to be successful.
We also mentioned that you're an author. You're an author of 2 books. Could you tell us a little bit more about those?
My first book is Brains, Trains, and Video Games, Living the Autism Life, and it is a personal memoir about my family and our son who has autism, sort of the journey of understanding that this is what the diagnosis is, and learning how to navigate the world with this child, learning how to understand how he thinks and perceives the world, and how to use his strengths to do just about anything, whether that's school or, playing or making friends, whatever that is. And it's a journey, for every family. And, I always say every family has a story, and this is ours. And it's, as you can tell from the title, Brains, Trains, and Video Games, it focuses a lot on those 3 topics. And, my son, much like a lot of other children with ASD, has an obsession with Thomas the Train, or he did when he was younger anyway. And that has now since moved to video games. My second book is Foods, Moods, and Isms, which is more about his secondary medical diagnosis of eosinophilic esophagitis and how that he accessed medical care and how that we got through sort of the barriers to quality medical care because he also has autism. So there are 2 things at play there, and trying to navigate both systems at the same time, it can be difficult.
Well, thank you so much for being with us today, Alicia. It was great talking with you.
Thank you.